Oftentimes patients ask questions about the balloon sinuplasty. The beauty of the balloon sinuplasty, it's the same technology that doctors have utilized to open up blocked blood vessels in the heart for years and years now. The angioplasty for the sinuses basically is the balloon sinuplasty. The balloon sinuplasty can be used to open up the sinuses above the eyes, inside the cheeks, between the eyes, and the back of the nasal cavity. The balloon technology has been with us since 2006. And the nice thing is it's a conservative way to gently open up those blocked sinus cavities. And in doing so, the changes that take place in those areas are long lasting. Studies have followed patients out 8 years and found that 90 to 95% of the patients have the same nice wide openings they had 8 years earlier. Symptoms that will improve with the balloon sinuplasty would be facial pressure, facial pain, frequency of feeling sinus problems or having sinus infections, and finally breathing pathways. Those gentle changes that take place inside the nasal cavities will actually help you feel more open and allow easier breathing through the nasal cavity.